Hey everybody, and welcome back to another episode of Hybrid Healing Hour. Today we're going to be addressing urinary tract infections.
Next to upper respiratory infections like colds and things like that, I think urinary tract infections are the most commonly seen infections that we see in our practice and in probably most primary care practices. So nearly 1 in 3 women will experience at least one urinary tract infection by the time they're 24 years old.
That's a lot. And half of all women will experience one urinary tract infection during their lifetime.
And if you're wondering why we're talking about women, it's because it's more common for women to have urinary tract infections. In fact, it's very uncommon for men to have urinary tract infections. So this podcast is largely going to be talking about urinary tract infections in women, although some of the things will apply to men as well. Typically, my rule of thumb is if a male gets a urinary tract infection, that's not normal, and that really needs to be looked into. And we need to find if there's an underlying cause.
Absolutely. And so let's talk, what is a UTI or urinary tract infection?
Most urinary tract infections occur within the lower urinary tract, specifically in the bladder. If it's in the bladder, it's called cystitis, or the urethra. And if it's in the urethra, it's called urethritis. It includes infections of the bladder, lower urinary tract, and infections of the kidney and upper urinary tract as well. But those are more serious. When there's an infection in the kidney or the upper urinary tract, it tends to be much more of a need for treatment.
Right. So if it's in the upper urinary tract, like the kidneys, we call that a complicated UTI. But if it stays to the bladder and it has not gone beyond the bladder, that's when we typically call it an acute simple cystitis. And so then there's recurrent UTIs, and that's defined as having at least 2 urinary tract infections in 6 months or 3 in a year. So we are going to dive right into this. So go ahead and tell us some symptoms.
So most people know the common symptoms. Typically, bladder symptoms are going to include something we call dysuria. And dysuria is pain when you urinate. You'll also have urinary frequency, urinary urgency, where you feel like you really have to go to the bathroom, and you could just empty your bladder and then just feel like you have to go again in a few minutes. And sometimes you don't urinate a lot. It's just the urge to urinate.
Right. And then there's suprapubic pain, which is right above the pelvic bone, the pubic bone, and it's your lowest part of your abdomen, and cramping or pressure. Some people just say they just have constant discomfort down there, and you can sometimes have a really strong odor in your urine.
And you have to remember that odor in the urine is not always abnormal. Right. It could come from food if you eat asparagus.
Yeah. And some people are lucky that they don't have that gene.
Right. And so you can also see blood in the urine, which we call hematuria, or on the toilet tissue. And you have to remember, you can have blood in the urine that's microscopic and you won't even see it, but it will be picked up on a urine test. In bad urinary tract infections, especially in elderly people, you can have confusion. In fact, many times when we have an elderly person come in, either from the nursing home or come home from their home, and they're acutely confused, one of the things we check for is urinary tract infection. But you can also have fatigue. You can have weakness.
And I wanted to tell a little anecdotal story about the confusion. So I used to work with somebody where her grandma was a seamstress and always dressed to the tens. Like she just knew good clothing and fashion and whatnot. And one time they came home from being out during the day, and they were getting ready to go out to dinner. And all of a sudden her grandma ran upstairs to change clothes and comes down in a garbage bag, literally a black, big, lawn garbage bag, and thought it was a dress. She was like, "Look at my new dress." And they were like, "Oh, Grandma, stop. Like, you're being silly." And she really did. And they knew immediately there was something wrong. And sure enough, it was just a urinary tract infection. They treated it, and she was fine after that.
It's amazing how fast people's mental status improves immediately after treatment.
Exactly. And, with the upper urinary tract infection, where it's more serious, when it hits the kidneys, you can have fever or other systemic symptoms such as chills or rigors. The fatigue is much worse typically because your body is just fighting off a serious infection. And this could even lead to sepsis at times. One of the testing we do in the office for a physical exam is we tap the back where the kidneys are located, where we call it the costovertebral angle. And that is, something, a sign that we see on exam if somebody's very tender there. That's of concern.
Yeah, there's a lot of nerve endings around the kidneys. And so if you ever have come in and had a doctor pound on your back, that's typically what they're looking for.
And so let's talk about who is actually susceptible for urinary tract infections. You've already said men are less likely, but let's talk about who else.
Yeah, so women are up to 30 times more likely than men to get urinary tract infections. And this is largely because of the anatomy of the urinary tract. So women have a very short urethra, and men have a longer urethra because it goes through the penis. And it's much easier for bacteria to get pushed up into the urethra in women. And then their opening of the urethra in women is also very close to the vagina and the anus. And both of those are areas that have a lot of bacteria, both good bacteria and bacteria.
Right. And more than 90% of bladder infections are actually caused by the bacteria named E. coli or Escherichia E. coli, or coli, sorry. And it's a bacteria that actually resides in the gastrointestinal tract. So this is very common. So if you have it sitting, like you said, the women, we have 3 holes that are all within a very close proximity. And that E. coli can just travel right up to the urethra.
And most people, their immune system is able to fight off a small amount of bacteria, but sometimes there's enough bacteria that it colonizes that area and then it starts to get out of control. Urinary tract infections are one of the most common infections seen during pregnancy. In addition to the uterus compressing the bladder, there are also elevated progesterone levels that can cause smooth muscle relaxation, causing urinary stasis, which is like pooling of the urine where it doesn't move much, and backward movement of the urine from the bladder up into the kidneys.
And as we already mentioned, men are less likely, but what about kids? So kids are susceptible to urinary tract infections. It is less common in certain ages, but we're not going to go into that today. We are focusing on adults.
Right. And so then there's less common bacteria other than E. coli that can also cause urinary tract infections.
Right. The few that we see is Enterobacter, the Proteus, Enterococcus, and Klebsiella. And there's many others out there, but those, this is exactly why we tend to run a culture to see what antibiotics are appropriate. And so tell us, what are some other less common but possible options of causes of UTIs?
Well, UTIs can be caused by funguses and viruses. The most common fungus that causes urinary tract infections is Candida albicans. And the most common virus that can cause urinary tract infections is cytomegalovirus, also known as CMV. But you also have type 1 human polymyositis and herpes simplex virus.
Right. And I know there isn't really a good way of detecting these. These are not necessarily something that will show up in, a urine culture. But let's talk about the difference between necessarily an infection versus having symptoms, because you can have symptoms of just an irritated bladder.
So this is what we see in our practice all the time. We have patients who come in and swear that they have a urinary tract infection, right? Because their bladder is irritated, or they're having burning, or they're having pressure. It is not always an infection. There are so many things that can cause irritation of the bladder. I have seen several times where patients were taking high doses of vitamin C that is irritating to the bladder, and they came in with typical urinary tract infections. We stopped the vitamin C, everything cleared right up. There are certain foods and drinks that can cause inflammation, like coffee, soda, acidic foods. There's
tomatoes, and even like ketchup is
Yep.
something that people don't realize, it's tomato based.
Right. And so one of the things that we tell people is, let's look at your diet. Let's see what can be changed or modified. Because honestly, we've talked about this many times in this podcast. If we can avoid antibiotics, we absolutely will. Antibiotics are not good for you. It is not a good idea to be on antibiotics. So our last resort is typically going to be antibiotics.
Right. And we also have to look at stress. That can cause inflammation throughout the entire body, including your bladder.
And stress also increases your cortisol levels, which in turn can cause relaxation of the smooth muscles and allow bacteria to travel up. Hormone abnormalities. We check for hormones in our patients for a reason. People with hormonal deficiencies are at higher risk for urinary tract infections.
Constipation. Also, I mean, when you have your colon right there, once again, in women, we are lucky that we have so many different body parts down there. We've got our uterus, we've got the bladder, the kidneys, and your colon is all sitting right there, and it can create pressure, pushing on the bladder.
And having another concurrent infection can increase your risk of urinary tract infection.
Right. Sometimes like a yeast infection, as you mentioned before, the candida.
Right.
And so sometimes I have some women who they're like, I don't know what I have right now. It's very uncomfortable down there. And so, things can coexist. And so let's talk about causes of urinary tract infection.
So believe it or not, medications can increase your risk of urinary tract infections. One of the commonly used medications currently for diabetes is a class of medicines called SGLT2 inhibitors. And these are Farxiga and Jardiance are the two most common ones used. What these medicines do is they allow the kidneys to block the reabsorption of glucose, whereas glucose, when it goes through the kidney system, your body takes it back up again. But now your body just pees it out. So the glucose goes into the urine, and therefore the urine becomes very sweet. Bacteria, funguses, they all like sugar, right? So when you have more sugar in your urine, there's a higher chance of having an infection. So these people are at risk for having urinary tract infections and fungal infections. And so typically if someone does have recurrent urinary tract infections, they need to be changed to a different medicine.
Right. And let's just say it, a lot of sex. So when you have a lot of sex, this was even coined the term honeymoon cystitis because all of the friction, you've got a lot of bodily fluids going on, there's friction and rubbing. And like I said, from all the women, we have 3 holes within very close proximity. Yep. So it's very important to take precaution with that.
And something that seems common sense to many people is the proper way of wiping yourself after you go to the bathroom. Mm-hmm. So there are people who aren't aware of the proper wiping direction, right? And
absolutely.
So what do you tell your patients?
I always say wipe front to back. And a lot of people, if you are, especially if you have arthritis and you can't wrap your shoulder around to the back to, come from the backside and pull front to back. So a lot of people just dip through the front of, between their legs and in the front and they'll wipe from front to back without even realizing it. And so I always say, you can still do that motion, but just push it back.
And I truly believe that bidet toilets are much more sanitary than using toilet paper. Toilet paper is a relatively newer thing in human history, right? And toilet paper, if you think about it, if your hands are dirty, if you get mud on your hands and you wipe your hands with toilet paper, they're not clean, right? And it's the same. So water is a better way of cleaning.
Right. And so any tight underwear, pants, jeans, I mean, think about it nowadays, everyone's walking around wearing like Lululemon leggings and whatnot. So, that all creates a friction essentially. And
it traps moisture and bacteria. It creates a warm environment for the bacteria to thrive. Harsh or strongly scented hygiene products. These can damage the good, healthy bacteria that live in that area. And we said before, the reason why we don't like antibiotics is because you have good bacteria as well as bad bacteria. And when you take an antibiotic, you're killing off the good bacteria as well. And the good bacteria is kind of like the watchdogs, right? They keep the bad bacteria under control. And so typically when someone takes an antibiotic, they're going to get a yeast infection because the good bacteria are no longer there to block the yeast and the yeast just thrives.
And one that I am always stressing in our practice is inadequate water intake. Most people do not drink nearly enough water. I always want people to drink half their body weight in ounces of water.
Certain types of birth control can increase your risk of urinary tract infections, especially birth controls that require spermicidal jelly like diaphragms.
Or condoms.
Yep, because they are also, the spermicides are also killing the good bacteria.
Friction exercises such as bicycling, rowing, or running.
Holding your urine too long. There's some people who wait, they'll go to work and they'll wait all day before they urinate. Increases your risk.
My nurses and teachers are notorious for this. I am constantly begging them to just go to the bathroom. And hormonal changes. So in our practice, we're huge on hormone replacement therapy, and it is proven that the drops in estrogen that occur during prior to menstruation and during menopause can cause a thinning and dryness of the urethral tissues, which is making them more susceptible to infection. So moisture, really the good moisture and lubrication, natural lubrication of your female genitalia is very important.
And along those lines, menopause also increases your risk. So plenty of women, once they may have never had urinary tract infections, and once they hit menopause, all of a sudden they get recurrent urinary tract infections. We've said this before, that we're big believers in hormonal replacement when it's needed. There's too many people out there, too many doctors that ignore women, and once they're in menopause, they say, "Oh, well, it's normal, it's natural. You're in menopause. That's all you can do about it." It's not true. There are things that we can do.
And a suppressed immune system, and we already talked about, once again, the gut, right? So we always bring back to the gut where 70 to 80% of your immune system lies. So you want to improve your immune system.
Having kidney stones can increase your chance of urinary tract infections because your body is amazing. There's different mechanisms in your body's tissues to block bacteria and to keep bacteria from invading. Whereas when you have a urinary kidney stones are inert. They're just chunks of minerals, and therefore bacteria can adhere to them, and there's nothing that blocks it. So it forms a source of where bacteria can propagate from.
And your usage of urinary catheters. So some people have to do a straight cath regularly on themselves if they have a bladder condition where they are not able to do it on their own. And some people, you might get discharged home with a catheter if you just had surgery or whatnot. So these are performed in a sterile environment. They are placed in a sterile environment, but they can always develop more an infection within the area.
Right. So now that we've talked about causes, do all urinary tract infections need to be treated?
No. And I think we made that clear earlier, talking about the, infection versus inflammatory cystitis. But this is what we do. So we collect a urine sample. We take a urine dipstick to the sample, and we can tell on the dipstick if there is of any signs of a true urinary tract infection. So there's a couple things that we look for, and that's called leukocytes, which are white blood cells. And we look at the nitrites, which are actually a result of when the bacteria go into the bladder or the urinary tract, and the bacteria turn these normal nitrates into a different nitrogen chemical called nitrites. And so we look to see, is there any signs of nitrites? Then we also look at microscopic blood. This is blood that you might not see. I always say, do you have any blood in your urine? So there's a difference between having gross blood, meaning yes, you see blood, versus microscopic blood. And this could be from the irritation or from the bacteria getting onto the bladder wall. And so when we see signs of a UTI in the dipstick, then we are okay with initiating some antibiotic treatments.
So let's talk about the proper way to collect a urine specimen too. When you go to the doctor's office and you give a urine sample, it's important. First of all, I recommend that you pee into the toilet first. You start your stream, and then you start catching the urine. You don't start initiating the urine directly into the cup right off the bat. Why? Because there's some bacteria that are at the opening of the urethra. We
have bacteria everywhere. And
Right.
So you have a normal flora on the outside, and that could go into the cup with your first drop.
Exactly. So we try to get what's called a clean catch. So urinate a little bit into the toilet and then start catching it. If you can clean the area around the urethra first, that helps as well.
And they make wipes for that.
And then it's also important to give us a fresh specimen. We have patients who will say, "Oh, well, I'll just collect the urine at home and bring it in." If there's any bacteria in there, the bacteria will start to multiply by the time it gets to the office.
I'm really glad you mentioned this, because I want everybody to understand we provide you with a sterile cup. Okay, urine in your bladder is sterile. It should be sterile. And so when you decide that you're going to rinse out your old jelly container and bring that urine collection in there. It's not the same. So we appreciate your effort. We'd rather you come to the office, urinate in our sterile cup for us, and leave it there, and we can take care of the matters at that time.
And the other thing that happens quite often, and it seems a little crazy, but people come in complaining of urinary tract infections, but they urinate before we get a chance to examine them. They'll go to the bathroom before we come into the exam room, and then they don't have enough urine to give us. So try to save up that urine.
Or ask the staff. Say, hey, I have to use the restroom. I will want to leave a sample for the provider or the doctor. Can you give me a cup?
And if you don't think you're going to be able to provide a specimen, then at least start drinking water as soon as you get into the office. Try to generate a little bit of urine. Right.
Because if there is true infection, it will still show even in diluted urine specimen typically.
And we said that many times, people will have symptoms that is not an infection, right? So if you have symptoms that are not going away within the first 48 hours with appropriate first-line treatment, then you may need to be checked for other bacteria or other things that we didn't talk about, like gonorrhea or chlamydia. And that's typically just another different type of urine test.
Right. And like I said before, so when we send out your initial urine for the culture and sensitivity, and that's going to tell us if the antibiotic we put you on is susceptible or not. And usually that culture, though, takes about 48 to 72 hours to grow anything. So the way they do that is they put a little bit of urine sample on a Petri dish. They'll put it in an incubator, let it grow for 24 hours. Then they can come back and put on little antibiotic drops, and they'll come back in 24 hours and see if anything is growing around those antibiotics, and it'll tell us the susceptibility rate and if the treatment is effective. So if that culture comes back negative and you were started on antibiotics and you're still having symptoms, we should then examine and maybe check another urine sample.
And we talked about urethritis earlier, and that's just inflammation of the urethra. It doesn't have to be an infection of the urethra, and especially inflammation around the opening. So you will get burning and with urination, and you'll get urinary urgency and frequency with urethritis as well. If you're having urinary or vaginal symptoms, including burning, itching, odor, discharge, then sometimes it may be necessary to get a culture of the vagina and the bladder as well to avoid an unnecessary antibiotic.
Right. So it's very important to tell us all of the symptoms you are experiencing when you come in for the visit. Now, talking about treatments. So acute treatments, we always want to make sure we check for pregnant, in pregnant females, they have to be treated. We don't want that to go longstanding or increase the risk of having sepsis or severe infection in pregnant females. But the first line treatment of antibiotics for uncomplicated cystitis, so just a typical bladder infection, we will typically start with the nitrofurantoin, and that's usually 100 milligrams twice a day for 5 to 7 days. And this is also known as Macrobid. This medication I like because it's not a systemic antibiotic. It typically stays right in the bladder. And therefore, most women do not end up getting a secondary fungal infection from this or like a yeast infection.
And we didn't talk much about antibiotic resistance, but we're seeing more and more resistance. So many people come in and say, I used to get urinary tract infections all the time. 10 or 20 years ago, my doctor always treated me with Cipro or with something. But we are not using the same antibiotics anymore, not because they weren't good antibiotics. It's because the bacteria have become smart enough now and have actually formed resistance. And that's the other reason why we don't want to use a lot of antibiotics in people, is because we are creating resistance. So as of right now, as of this podcast, nitrofurantoin, which you just talked about, we're not seeing a ton of resistance to that one. Right. And so it's still a fairly effective antibiotic. Whereas the next one are going to talk about, we are seeing more resistance to.
So Bactrim DS, which is double strength, or its generic name is trimethoprim sulfamethoxazole. And that one it's very nice actually, because you only take it for 3 days. It's twice a day for 3 days. Sometimes depending on the dose, you can even do 1 tablet a day for 3 days, depending on your symptoms. And, but yeah, we also use that for a slew of other conditions, and therefore we are seeing some resistance.
And you also have to be careful. People with sulfa allergies absolutely can't take that. And it can affect kidney disease. So you want to be very careful with who you use that one on.
Yep. And another one is phosphomycin. This one is even better. It is one single dose. It's actually in a powder, 3 grams, and you mix it and drink it. We've seen great success with this, but on the other side of that, I don't want to just give this out either because it does work and we have this. It's not new, but it's also, I guess you would say, newer. And right. So we only want to give this if we have proof that that is the one that works.
Right. It's not a good idea just to say, oh, you may have a urinary tract infection. Here, take an antibiotic. And unfortunately, that's what we're seeing a lot with urgent care centers and people who, it's a lot easier for a provider to say, take this antibiotic than it's to say, well, just wait it out and it'll get better in a few days. People want instant gratification. We are an instant gratification society, and that's not a good thing. So we have things other than antibiotics that may be beneficial as well. There's different antimicrobial and anti-adhesive herbs and supplements that can help with urinary tract infections. And some of the ones we're going to talk about have actually been studied, and there is evidence that that show that they help. Of course, everyone knows about cranberry, but there's other things as well. So one is uva ursi, 300 milligrams 3 times a day. This is an evergreen plant that produces red berries. And typically, if you're going to use this one, it's better to use it in conjunction with ibuprofen. And that's been shown to help with urinary tract infections. There's another supplement we use for many things in our practice called berberine, 300 to 500 milligrams 3 times a day. And that's been shown to be beneficial. And then cranberry extract, at least 400 milligrams 3 times a day. So people always say, well, how does cranberry work? And, the theory used to be that it was making your urine acidic and that helped with the urinary tract infection. But actually, that's not what it does. Cranberry contains a substance that can prevent bacteria from sticking to the walls of the bladder. And you need to know that cranberry juice has not been found to be beneficial. Cranberry juice does not do the same thing, largely because the concentration's not there, and you would have to drink a lot of cranberry juice to get the same benefit that you can get from cranberry capsules. So we recommend cranberry capsules, at least 400 milligrams 3 times a day for urinary tract infections. Then there's another supplement called D-mannose. D-mannose is a type of sugar that's related to glucose, and it's found naturally in fruits. And the typical dose of that is 2 grams twice a day. And that's thought to work by inhibiting E. coli from attaching to the wall, the uroepithelial lining, which is the wall of the urinary tract. So when you prevent it from attaching, it can't cause the infection.
Yeah. And then, so talking about the recurrent urinary tract infection. So if you, as we already mentioned, are having, 3 in a year, we definitely want to investigate why. So it comes back down to supporting your natural defenses against infection, right? And once again, I'll repeat, microbiome. The gut microbiome is where we want to look because this can actually have a huge impact on the vagina and bladder. I mean, like I said, again, the 3 holes in a woman are all within close proximity. So it's very close. You have normal flora on the outside and you have good and bad bacteria on the inside of all body parts. And so taking antibiotics for another infection can actually lead to an infection. Like we already said, a lot of women are like, oh, I'm on antibiotics, so now I get yeast infections, So we are killing off the good bacteria to keep that vaginal pH sustainable. And so when that pH changes, that puts you at risk for infection. And the same thing can happen with the bladder. And so dietary changes can also disrupt your flora and the pH balance, specifically eating a lot of sugar or drinking a lot of alcohol. Once again, that kind of goes back to honeymoon. If you are having a lot of sex, you're drinking more alcohol and you're eating well and indulging in sweets, you are definitely going to be prone for getting a UTI. And it doesn't have to be a lot. It just has to be what is more than your usual. Anything more, like even if you don't drink alcohol very often, but you ended up drinking on Friday, Saturday, and Sunday, that puts you at risk. And so let's talk about tips for preventing a UTI. This is my favorite part. This is what I love talking about in the office with our patients.
Because it's all about preventive medicine,
Yes.
right? We don't want to treat
Right.
something that we can prevent. So the first one you've talked about, and we'll talk about it with everything we ever discuss, which is drinking plenty of water.
Right.
Make sure you're drinking enough water. There's no rule of thumb as to how much water you should be drinking. It should be plenty, though, especially if you've already had a history of urinary tract infections or kidney stones.
Right. And I mean, you say there's no rule of thumb. I do. There is a rule of thumb. I say half your body weight in ounces of water. So if you weigh 120 pounds, I want you to be drinking 60 ounces of water. And that's just to give an idea. And because I like that rule of thumb, because most people, it's an eye-opening experience. Most people realize, holy cow, I'm not even coming close to that. They're drinking like a 16-ounce Zephyr Hills bottle, right, a day. I'm like, no, you need to be drinking like 3 of those. So to me, it's just amazing. And then going in hand with that, when you drink more water, guess what? You are going to have to pee. So let it go. You need to run to the bathroom. You need to go and empty your bladder regularly. At least, even if you don't have to go, you should be going about every 3 hours at most. I have like the teachers and nurses, typically, they're the ones that are like, oh, I just hold my bladder for like 6 to 8 hours. I'm like, that is insane. Y'all don't even want to know how much water I drink and how many times I go to the bathroom. And it's good exercise. You're getting up and down, up and down.
And so going back to a rule of thumb, if you're not going every 3 hours, you're probably not drinking enough water.
Exactly. And the color of your urine, and not that this matters for infection or anything, but you should be drinking so much water that your urine should get lighter in color as the day goes on. Like it should, it's going to be normal that it's a darker yellow, concentrated in the morning. But as the day goes on, it should get lighter and lighter, like a light yellow, almost clear. And that's a good rule of thumb, in my opinion, of hydration. Yes, certain vitamins, that's a caveat. Certain vitamins will make it bright yellow or different color, right? But you should understand that the concentration is thinner.
And for women who are predisposed to urinary tract infections, we recommend wearing cotton-lined underwear and also avoiding thong underwear.
Right. To me, that is just a gateway right there. It's like string rubbing right up against the anus, and going right to the vagina and the urethra. So avoid being constipated. I talked on this before. You want to make sure you're getting plenty of fiber to make sure you're having natural bowel movements. Because also I talked about, the pressure causing cystitis, and it's, if your poop is sitting in the vault of your colon right there. But it is also, that's where the E. coli is residing. If you actually have stool sitting there, like you probably have a little concentrated level of E. coli that's right there. So just make sure you're emptying your bowels regularly.
And avoid sugar. Avoid sugar in all forms. That's not just desserts. I'm talking about sugary drinks. Sugar is in so many different forms today, and it's added to everything.
And we know bacteria and candida, which is yeast, love sugar.
And it's not just sugar. High fructose corn syrup.
Right.
All that
crap. And decrease stress, as we already mentioned, that stress increases cortisol, and that therefore weakens your immune system. So go back to reducing your stress intake.
Okay. And we talked about wiping, wipe back to front, especially after having a bowel movement. If you can, use water or use a bidet.
And cranberry pills. This, like he already mentioned, it can help bind to the bacteria so it doesn't bind to you.
And we also talk about D-mannose. D-mannose can be used as a preventive for people who have frequent urinary tract infections because it creates that Teflon lining on the bladder that keeps the bacteria from sticking to it.
And then you want to reestablish basically the healthy urogenitalia or genital microbiome. So how do we do this? It's probiotics. So the lactobacilli species of bacteria are predominant in the genitourinary tract, specifically of premenopausal women. And so the lactobacilli produce hydrogen peroxide. This inhibits pathogens from adhering to the bladder wall. So we actually have a supplement. There's a product in our office that we carry that has 6 strains of bacteria, including the Lactobacillus rhamnosus, and Lactobacillus reuteri. Those specifically are effective in preventing recurrent urinary tract infections in women. And there's studies on UTI treatment and prevention have used the probiotic doses ranging from 10,000 to 10 billion, and they're considered CFU is the way they are dosed. And in doing that daily for 5 days to 12 months. So I recommend, I highly recommend this for my recurrent urinary tract infection, or even my yeast recurrent candida infection.
And remember,
patients.
not all probiotics are created equal. So it's important to get a good quality probiotic. And, you don't have to use the one we have in our office. Of course, it's, people are listening to this from all over the place. But what we can do is we can put a link to FullScript in our description, and you can just go to that link and you can order from FullScript if you want.
Right. And just specifically get the Lactobacillus rhamnosus or Lactobacillus reuteri. And then obviously I love talking about exercise. So exercise can also strengthen your pelvic floor. And we know this. You can do a Kegel, right? This is going to help prevent any leakages that increase the urinary tract infections. I mean, this is another thing that we haven't mentioned is, especially in people who experience incontinence, if you cough, you sneeze, or if you typically wear a pad, a panty liner, or an adult diaper, these are things that need to be changed frequently, because if you are just sitting in the leaked urine, I know it sounds disgusting, but you don't know how much is in there. So I would actually recommend to change it frequently, every few hours, whether you feel quote wet or in quote, or not. So this is something that you definitely want to continue to work on, pelvic floor exercises. And in our office, we have the Emsella chair, which I love. This chair is as if you did nearly 12,000 Kegels in one session. And we have seen great success with improving not only incontinence, but it also helps bring blood flow to the area, therefore helps with the lubrication. And it all goes right back to everything we mentioned on how to prevent urinary tract infections.
And these are all natural ways of doing it. And we tend to take urinary tract infections lightly, like, it's just some burning in the urine. But no, you can die from urinary tract infections. It doesn't happen very often, but you can. If you have an elderly family member and you find that they're all of a sudden confused or not acting right, always think urinary tract infection in the back of your mind.
Absolutely. And get them checked immediately. If we can prevent hospitalization of this or further infection of anything else, that is our goal.
So I think we've covered all the important points.
Yes. I'm sure there's more out there, but I hope you all learned from this and can seek medical attention immediately if you have any of these symptoms.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.